Good morning. We have Nancy Gimpel with Aipermon, and she is going to demonstrate the Aipermotion. Thank you. Thank you, Nancy. And we're on physical therapy diagnosis. This is a blog for about 1,000 physical therapists a week. Nancy, can you tell us a little bit about the Aipermotion device?
With the Aipermotion, you can count all the calories you burn by motion all day long via a simple menu.
Can we show that to the, it's not on, there we go.
Yeah, via a simple menu you can enter what you eat all day.
Okay.
So you just go on menu and you select different meal types to put in what you eat. So you go on input and meal and drink, and then you can just choose different meal types between breakfast, snack, cold meal, warm meal. You just go on this, and then you always have mini, normal, and maxi to choose between.
Okay.
And there are calorie values behind this, which is set up for your personal data that you enter.
Great.
So the device calculates all the calories you burn because you wear it either in the pocket of your trousers or in a small pocket on your hip all day long. Whenever you eat something, you take the device, you enter what you've been eating by a meal type and mini, normal, and maxi.
Right.
At the beginning of the program, the patients get an educational lesson on what meal type they should choose, what is mini, normal, and maxi, and how to use the device. And also calculated on the device is your basal metabolism.
Okay.
Because you enter.
See if we can get a shot of that.
Yeah, because you enter age, height, gender, and weight into the device. And so whenever you go on menu and on analyzers, for example, for today, you see on plus what you've been eating.
Okay.
You've not eaten anything
and now,
today.
Nancy, this is yours.
Yes.
We're talking. This is, and you've not had anything to eat at the American Telemedicine Conference in Tampa, and it's going to be a long day.
We're going to have breakfast in a few minutes, hopefully. And so that's my basal metabolism on mine is here.
That's a good thing. Okay.
And that's the exercise I did tomorrow. I did this morning to go to the bus, to go to the conference center.
Just to get here.
Yeah, just to get here. So that's the calories I burned. And down here you see the energy balance minus 1,500.
We need to get you something to eat.
Exactly. So that's how the device works.
Right.
And what we did is we applied this to a weight loss study with diabetic patients.
So we have an outcomes study with diabetic patients.
Exactly. And what we did in this study is shown here. All the data you collect with the Aipermotion each day can be sent via software, via internet to a physician or a nurse or a dietitian, whoever supervises the patient in a study or in the program. And the supervisor can log onto a software to look at the data that's sent to him or her once a week and send a personalized feedback letter back to the patient.
Right.
So we did this in a weight loss study for half a year with diabetic patients.
And how many patients?
88 patients.
88 patients.
We had 44 in the intervention group.
In Germany. 44 in the intervention and 44 in the control. Exactly.
It was done at the University of Magdeburg in Germany. And the professor... Professor Lule, he invented the whole program with our Aipermotion device. And once a week he sent letters to this patient.
And that's this graphic here just showing personalized feedback once a week.
Exactly, that's what he did once a week. And the patients lost around about on average 24 pounds in 6 months. 24 pounds. And the HbA1c value decreased by 0.9%. And we could stop anti-diabetic medication or reduce them with 81% of the patients.
Wow, that's huge. That's huge.
Yeah, and we had 3 cases on which people were on insulin, and we could stop their insulin intake, so they don't have to take insulin anymore, which is quite quality and improve in their quality of life.
Right. Nancy, in Germany patients have universal access to health care, and the device is paid for through a mix of private and public funding.
Exactly. There are some health insurances that pay for it, mostly the private health insurances.
Mostly the private.
The public, they make the patient pay at least a little amount.
A little cost sharing,
to take part in the program. What we found out is that it's still okay to give these costs to the patients as the compliance gets better when they pay a small amount of money.
That makes sense. That makes sense. Very good. This is some exciting technology from Aipermon, and this is Nancy Gimpel at the American Telemedicine Association in Tampa. Thank you, Nancy.
Thank you.